guys. Today I have a lovely patient. She's at the young age of 75 years of age, and I met her a few months back, and she's had a tummy tuck, and we were just discussing her healing process and everything, and she brings up so many good points, and so I just want to go through a few of them because I think it's going to be educational and maybe encouraging for other women. And so she went through bariatric surgery, which is a huge ordeal, and a lot of people have done it. And so that was 9 years ago. She underwent bariatric surgery, and she lost 80 to 90 pounds in that time period. And so she went from a size 24, size 24, all the way down to a current, she's now a size 8. What were some of the reasons that you decided to proceed with having a tummy tuck?
Well, the primary one was the way I felt about myself when I had this wad laying in my lap.
Yeah.
And it didn't matter if I walked, if I exercised, I just couldn't do anything with it.
Yeah, and so that wad is a loose, she calls a wad, otherwise known as loose skin, right? But yeah, it's that loose skin that flaps over, and it also made it uncomfortable to wear certain clothing and stuff
Sure.
like that.
Sure.
Yeah.
It made it difficult because you have to have pants with a big enough waist to accommodate my wad.
Yeah, yeah,
And I didn't like that.
right. And now?
And now I'm in a size 8.
Yeah, that's
And
awesome.
I don't have to worry about buying pants with a big enough waist for the wad.
Yeah. Now you also shared, and I think a lot of women have this, about kind of some of the mental, just over years and years and years of one, being overweight, and then two, having that weight loss, but then having all that skin laxity.
Not that I wanted a Christy Brinkley body
Right.
or a Jane Fonda body, but I wanted a body I could be comfortable in.
Yeah.
And even though there are probably some other nips and tucks that could make my body look better, I'm happy with what I've got, and that wad being gone was for me a lifesaver because I was getting depressed.
Yeah.
I felt so badly about myself that I was getting depressed.
Yeah.
And I didn't want to go onto antidepressants, and I
Right.
didn't want to go see a shrink.
Yeah.
I wanted the wad to go away.
Yeah, exactly.
And you
Yeah.
fixed it.
And so that's an important thing too with functional medicine, and you guys know that I not only do cosmetic surgery, but I also talk to people about the function of life, and oftentimes we throw antidepressants at things.
Right, yes.
And so whether it's making sure you're eating more healthy, you're exercising, you're getting your sleep, all these things that if you're not doing well leads to depression, or it's that you have some issues going on with your body that can be surgically correct. You don't need maybe an antidepressant. You just need to have something done. And the other thing so one thing people already said, they hear the word 75 and then they hear the word tummy tuck and they're thinking like, okay, can any woman at 75 have a tummy tuck? And the answer is no, right? And so
Absolutely.
you have to be healthy. And so that's a discussion that we had beforehand, is that she does not have diabetes. She does not have hypertension. She was walking 3 miles prior to the surgery, and she's walking 3 miles every single day. And so you've got to be physically fit in order to have it. And so we just don't want to say that we do it on any patient that's an age over 60, because a lot of people have cutoffs. I do those surgeries, and have had multiple women in their 60s, I think you're actually in the 75s, who unfortunately, this is just something down here in the valley. We know that diabetes and hypertension is rampant. And unfortunately, most of the women at age 75, if we were to look across the board here versus maybe California and Southern California where I'm from, you're going to have a lot more diabetes, hypertension. But if a person doesn't have diabetes and hypertension, otherwise healthy, the only thing that you have is just you take a little small dose of thyroid medication, which hypothyroidism is no risk factor for the surgery as long as it's well controlled. How did you feel that the healing process of the surgery was?
Actually, I was fairly pleased with it. The binder jacket or wrap that I had to wear was probably the most uncomfortable part of it, because after like day 3 I didn't take any. So the binder was probably the most uncomfortable.
The compression binder
part.
can be uncomfortable. Yes.
Yeah.
Yeah.
But after the first month, I got to where I liked wearing the binder.
Yeah.
It made it easier.
Yeah.
Yeah. So the pain level was nothing to write home about. I didn't have a problem with it. You prepped me well in advance.
Yeah.
Probably made it sound worse than it was, so when it wasn't, I was pleased.
Good. So let's just show you right here, y'all. This is her incision. She used to have a big flap that came down. That flap is now gone. You can see her incision is nice and low. She just looks absolutely amazing. So we are so happy for her that she what do you call it? The glob?
The wad.
The wad. She no longer has the wad she's dealing with. She's able to sit down and just feel nice and comfy. She's got a very cute little belly button there. She's looking, like I said, hot. As a
Awesome.
75-year-old woman. So, anyways, we really appreciate her showing us and going over with that, because I know it's going to help our patients, because I talk to them about it every single day, and hopefully they're encouraged by you and saying, hey, it's something that can be done.
It is, and it makes such a difference in my mental health.
Yeah.
I mean, there's enough things out there to make me go crazy. I certainly didn't want my wad to do it.
Right.